We can add one more item to the list of problems caused by the pandemic. Doctors say the shutdowns led to increased back pain because people stopped going to the gym, laid on the couch, and ate too much junk food.
We have to actively stretch. We have to actively do things to make sure our bodies remain as limber as possible.
That's because bodies naturally get stiffer as we age, increasing the risk of back injury. Spinal surgeon Dr. Bolan Okubadejo says maintaining flexibility is the #1 way to prevent back pain. He recommends stretching at least 15 minutes a day, 5 days a week.
If your quads are tight, if your hip flexors are tight, then they won't move in the way that they're designed to, and the stress goes somewhere else. And the body, for whatever reason, tends to have the stress go right into the lower back.
The next best move to avoid back pain is by strengthening your core muscles by doing exercises like leg lifts, planks, and sit-ups.
So you are strengthening your abs, you're strengthening your core, and that in turn protects your back and gets your back healthier.
Whether at home or the office, strive for an ergonomic workstation.
So if you're working at your dining table, be aware of the height of the table. Maybe get a chair that can adjust to a height where not as much stress goes into your lower back. Another thing that I love is a standing desk.
Extra pounds can strain bones and muscles in your back, so try to maintain a healthy weight. Also, avoid sugar, which can lead to inflammation, the root of most low back pain. Doctors recommend giving up smoking because it restricts blood flow to the spine and impairs your body's ability to heal. Also, consider where you sleep.
If your mattress is too soft and your back sinks into the mattress, then your risk of injury becomes higher.
When getting dressed, avoid flip-flops and high heels when possible, and take other precautions.
You want to put your pants on from a seated position where you're not stressing your lower back.
Try to bend at the knees when picking things up, not at the waist. When back pain does arrive, doctors say it's better to move around rather than staying in bed, and proper medication can help.
A combination of the proper anti-inflammatory and non-prescription analgesics can often lessen the pain and prevent us from going down the route of opioids.
When drugs don't work, sometimes surgery is an option.
When patients have what we call radicular pain, so pain that travels down your arms, that's relentless, and your MRI shows something that clearly puts pressure on the nerves, that's surgical. So if you have progressive weakness in either your arms or your legs, if you have issues with balance, and your MRI or CT scan shows clear pressure on the nerves, that's surgical.
So while millions of Americans suffer from back pain, the good news is it's often preventable or at least controllable. With a little know-how and a few important lifestyle changes, we can age gracefully and avoid this common affliction. Lori Johnson, CBN News.